Well, an Mpumalanga mother is reeling following the death of her baby over the weekend. The 15-year-old passed away after what the family claims to be poor treatment at a state hospital in KwaMhlanga. The family alleges that no doctor attended to them, which caused the young infant's death. For more on this ordeal, we're joined by the mother of the infant, Sibongile Mahlangu. Sibongile, good evening to you, and thank you so much for your time. Firstly, condolences on the loss of your child. I can't imagine what a difficult time it must be. Tell us what happened.
Okay, ma'am. Thank you. My child started getting sick on Saturday, and then we took him to the doctor on Sunday at KwaMhlanga, Dr. Sukhuwa. And then when we arrived there, doctor gave him medication, and then he told us to give the baby the medication immediately. We did that, and then we brought the baby back home. And then the child started getting sick midnight Sunday. And then we took the baby to KwaMhlanga number 2 clinic on Monday. And then they told us that they can't help us because they found someone with COVID. And then we decided to go to KwaMhlanga. That's where they told us to go to KwaMhlanga. We arrived at KwaMhlanga hospital around 1:30. When we got there, I told the nurses that my baby is having problem. He can't breathe very well. They took the baby, they took his weight and the temperature, and they told me to wait for the doctor. That time it was around 2 o'clock in the morning. I waited for the doctor up until 3:30, and the doctor didn't show up. I then sent a text to my auntie to come fetch me, since the baby was crying and no one was attending to him. And then my auntie told me to wait. I waited until 4 o'clock. I again sent the text to her, and I said, around 4:30 you must come fetch me because no one is attending to me, and the baby was crying badly and the nurse was sleeping. 4:30 they came to fetch me, and then we took the baby back home. In the morning around 6:30, the baby started crying badly again. We then took the baby to Dr. Sukhuwa at KwaMhlanga complex to go and do X-ray. Maybe he was gonna be able to find out what was the problem with the baby. When we arrived there, they told us that the doctor who deals with X-rays is not there. We then decided to take the baby to number 1, to Dr. Sibongile. When we arrived there, the doctor confirmed that there's something on the baby's throat. He then gave me medication and a spray to use on the baby. We immediately used the spray on the baby, and a white foam started coming out of the baby's mouth. He then started getting better. We took him back home. By that time it was around 2 p.m. And then when we arrived, we gave him food, which is his bottle. And then we decided to put the baby to bed to sleep, hence he was tired. After an hour, which was 3:30, I decided to change the baby's side, hence he was facing the other side. And then that's when I realized that my baby was normal.
It's an incredibly devastating thing to have to go through as a parent. Sibongile, when you were sitting in that public hospital and hoping for some kind of assistance from the nurses, what were they saying to you?
Okay, the first thing they asked me, what am I giving the baby? I told the nurse that I'm mixed feeding, hence I have to go back to school. So the baby kept crying badly, and then I kept telling the nurse that my baby is crying. He can't breathe very well. And then she said, what do we expect, hence you are mixed feeding.
So they didn't try and help you in any kind of way and help in terms of providing some kind of assistance for your child?
No, they didn't.
How are you feeling about all this?
I'm very disappointed and very sad.
That's completely understandable. Thank you so much for coming onto the show tonight and for sharing the experience that you've had there. Sibongile Mahlangu, who is the parent of the infant who subsequently died, as you heard there, following them not being assisted at a hospital. Well, we're going to stay with that story and, in fact, take you now to the Mpumalanga Treatment Action Campaign chairperson, Newzroom. Good evening rather to you, Mr. Chabalala, and thanks for your time. This experience that Sibongile has had when it comes to lack of, delivery, lack of support even, of services at a hospital where you really have nowhere else to run to in the case of a medical emergency. You as the Treatment Action Campaign, what's your response?
Good evening, Katie and your viewers. First of all, I would like to send condolences to Umam Esther for the passing of baby Zano. As Treatment Action Campaign, we felt the pain that she's feeling now, and we are with her. Our role as Treatment Action Campaign, in our 23 years existence, we've been fighting for access to quality healthcare services in Mpumalanga and across South Africa. TSC duly mandated by Section 27 is our constitution that says everyone has a right to access to healthcare services. On this matter of Umam Esther, we, as TSC, we are very devastated by this issue to learn about this, and we will ensure that those who need to be brought on book must be brought on book. And we can say that in the past 3 weeks, we have received 2 extreme cases that involves babies being denied access to healthcare services in Evander Hospital and KwaMhlanga Hospital, where babies are now end up dying because of poor healthcare system and not being assisted. As Treatment Action Campaign, we have learned that there's a number of issues that are happening in these hospitals or in these health facilities across Mpumalanga. There's a number of things that we identified through one of our projects called Rechitsa Project. Through the Rechitsa Project, we have identified that there's a high level of staff attitude that are being experienced by communities. There's a high level of waiting times, and there's also issues of stock out on essential medicines, issues related to the shortage of human resources, and issues related to the infrastructure. We are having those issues that are being identified through the Rechitsa program. So based on these issues, it put our health system in crisis in Mpumalanga to be able to deal with these issues. And especially if you look at the issue of Umam Esther, the main issue on this issue was the issue of staff attitude, where she needed a support and she was not supported by the Department of Health, where she needed them to come on board to assist her baby to survive, but they were not there to let the baby survive. So it's one of the issues where we experienced negligent cases, and that being unjustified by the Department of Health.
It's shocking to hear that, she was left to sit there with her baby crying while the nurses were sleeping, at least by the version that she's given us tonight.
If the issues of staff attitude is the main issue that through the Rechitsa program, that through even our THC branches, we have identified and been reported. We've got a number of cases of staff attitude being reported to us as Treatment Action Campaign, where nurses are not able to respond to issues of communities, where communities, when they need assisted in our health facilities, are not being assisted, where communities are even afraid to go to health facilities. And remember, Kate, one of the main issues that is affecting us as communities who are the public users of the healthcare system is that even the structures that we need to report these issues, structures like hospital boards, structures like clinic committees, are dysfunctional. So all these issues even if have been reported, they go unnoticed. No one take a stand to these issues. Hence, most of the people now, they come to TAC to report these issues. And as Treatment Action Campaign Mpumalanga, our doors are open for people to come and report these issues of negligence that is happening in health facilities. And we will take upon these cases and ensure that justice is being served.
Ngobile Shabalala will certainly keep in touch with you to find out exactly what the outcome of this particular matter is. He's with the Mpumalanga Treatment Action Campaign, and he's the chairperson there, and we certainly extend our condolences to Sibongile, who is the mother that has lost her infant in this instance.